As COVID-19 vaccines continue to roll out across Canada and around the world, many are hoping it could bring an eventual return to everyday life. But health experts warn COVID-19 could become endemic. Rather than being eradicated, the virus becomes a part of day-to-day life. In other words, the virus may never fully leave us. Dr. Suman Chakrabarty says respiratory viruses are not easy to get rid of because they evolve over time in terms of how they impact people.
It's going to change the way it actually is over the next several months and become something that's more like a circulating virus, like we see with influenza. It tends to cause problems in the wintertime, but it's something that's not going to be the same type of bad pandemic spread that we're seeing right now.
An infection becomes endemic when it transitions to having a low level of transmission with only small spikes in spread. The Centers for Disease Control and Prevention in the US defines endemic as the constant presence and/or usual prevalence of a disease or infectious agent in a population within a geographic area. In fact, the 4 common cold coronaviruses, which are considered cousins of the virus that causes COVID-19, are already endemic in many parts of the world. H1N1 and the Zika virus can also be considered endemic. With emerging evidence that vaccines may help stop the spread of COVID-19, global health epidemiologist Rewat Deonandan says that could change the course of the pandemic.
Now, because the vaccines diminish transmission, we think, in a powerful way, the likelihood is that COVID will be endemic in an unnoticeable way, kind of like the flu. So the flu, every year, the vaccines have at best 40% efficacy. And the uptake is at best 40% in a good year. This past year, maybe it got higher because people were scared. And yet the flu kills tens of thousands every year, but never makes the news because we live with the flu. So COVID will go the same route, likely. The vaccine is better, the uptake will be better, but the disease is more lethal and more transmissible. So the combination of those things probably means it'll be with us, but not newsworthy.
Even if COVID-19 becomes endemic, there is the question of what this means for people who want to do activities they did before the pandemic and countries reopening their economy. Chakrabarty says vaccines will have a big impact because they can take a severe disease from a public health perspective and turn it into something non-life-threatening.
You can have a lot of pressure taken off the hospitals. You're saving lives, you're saving morbidity, and all these types of things are our ticket out of the pandemic. I do expect that we might need boosters in the future, but to have another pandemic with this same virus is very unlikely, so things will largely get back to normal as 2021 rolls on.
Infectious diseases specialist Dr. Isaac Bogosh says he looks at the pandemic from a short to long-term perspective.
We're masking, we're distancing. We got to be careful. We might have a third wave. We got to be very careful here. That's current. The near future, third wave or not, let's say we're on the tail end of April or May, it's summertime, we'll probably have, anyone in the country who wants a vaccine will have access to a vaccine. I think it'll be a lot different. We'll probably start to see a gradual lifting of some of the public health measures, right? More and more people allowed to gather in indoor settings, more and more people allowed to gather in outdoor settings. But we'll probably still have some public health measures in the near future, and then longer term we'll probably all get an updated vaccine that accounts for the variants of concern. We'll see more global vaccine delivery. We'll probably see some lifting of measures at the US border and greater international travel.
Deonandan says while people may be able to do more things in a post-pandemic world, we may see masks become more normalized.
I don't mean wear masks all the time. I mean, if you are sick, if you got the symptoms of even the cold, it'll be socially normal to wear a mask before getting on the subway to protect other people.
He says there could also be symptom checks more often for school children, and working from home may become more frequent. So going to the office with the sniffles will likely be a thing of the past. Health experts, however, caution Canada is not yet out of the woods. British Columbia's top doctor, Bonnie Henry, says what we do this year matters in terms of getting out of the pandemic.
Our post-pandemic world is going to be in the next few months, but it's going to depend on us being immunized and protecting people, and particularly, protecting those most at risk.
With COVID-19 potentially here to stay, Bogosh says some normalcy may return, but there will be changes.
We hopefully have all been vaccinated and perhaps have been revaccinated. I don't think that it's going to cause the same degree of disruption. And then, like the quote unquote post-pandemic world, yeah, it's probably going to look a lot closer to 2019 than it will to 2020, but it's probably not going to look exactly like 2019. So I think there's going to be some fundamental changes.
Sean Previl, Global News. Thanks for watching Global News. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel.